I'm Dr. Shanmugam. I'm a member of the Temple of Fine Arts. I'm one of those original founding members for this clinic, which is now situated at 11 River Road. This location has been selected because our Guru Swami Shantananda used to come and stay here when he was with us in his physical form, and we thought that it'll be an ideal place because we are hoping to set out his ideals by doing the service here, and no other better place than where he was. He had slept here, he had stayed here, he had had spiritual discourses here, and so we still feel that the vibrations are still here, and so we thought this would be a nice place to have the clinic. The name Sivasanta, what's the origin? Shiva means we have named it after Swami Shivananda. Swami Shivananda was Swami Shantananda's guru. Swami Shantananda was our guru. So it's a combination of the names of both the gurus, Shiva Shanta. This name was approved by Swamiji himself, and so all our charitable clinics all over the world is named as Shiva Shanta Clinic. We have clinics in many places. It's not only in Malaysia, it's international as well. In Malaysia, we started in Kuala Lumpur in the year 1982, and subsequently in Penang in the year 2000. And we have in other places like in Malacca, in Johor Bahru, where the free clinics, and in some of the places they conduct medical camps regularly rather than a stationary clinic. Internationally, we have it in Singapore, we have it in Perth, Australia, and we have it in India. In India, it's located in two places. One is in Madras, and one is in Coimbatore. The one in Madras is run by a pediatrician. She has a pediatric clinic there, and there's also a general clinic catering to general cases. In Coimbatore, we wanted to set up a hospital, and we wanted it to be unique, so we set up a mother and child hospital. It's a 4-story building where we are presently having only clinics, but soon we'll be having inpatients as well. And all the major cases gets referred to the hospitals, and the Sivasanta Clinic actually bears the cost of the treatment of the patients in the hospital. Now in the year 2000 when we set up, we have grown in leaps and bounds. The present schedule for seeing cases is on Tuesdays and Fridays in the evenings. That's the time when most of the doctors who are actually full-time doctors working elsewhere take time off and come and devote their time looking after patients on a completely charitable basis. There is no financial remuneration, nor any payment in kind. It's just each one feels that they feel nice coming and serving, and they take it as their duty to come and do it. And they do it with all the love and big heart. We see about 100 patients a week now. That is the medical cases. Besides the dental unit, which was set up fairly recently. In the medical clinic, we wanted this to be a unique kind of setup, and therefore we have also subspecialties. We have cardiology, we have chest physicians, we have orthopedic surgeons, we have pediatricians, we have dermatologists. So all the various specialties are involved. Now, how do we cope? We have doctors from all specialties offering their services. So to make it most beneficial to patients, we have schedule for the doctors. And these schedules are prepared 2 to 3 months beforehand. And once their schedule is printed, it's distributed in the neighborhood so that the patients know which specialty doctors are coming on that particular day. And this we find it most beneficial to the patients. Then we can treat them for that particular disease condition, and they get most benefit by this. To my mind, I think this is the only charitable clinic offering specialty services, and we hope to expand our services. Presently, we have an eye unit with almost full equipment with a slit lamp, which was donated to us by the MMA Foundation, and soon we will be acquiring an ultrasound machine for our gynecologists who will be able to do ultrasound of the abdomen to detect early disease. Therefore, in stages we are expanding. Of course, financial constraints are a problem, and therefore we are appealing to the public to donate to this cause, and we ourselves are contributing so that we can build this place to be a very much bigger place with better facilities. The aim of setting up this clinic, we started off as a spiritual group, and our Guru emphasized to us, spirituality is not just sitting and praying. Spirituality is also service, and no better service than medical service. And it so happened that we in the group itself had a core group of doctors, but now besides the core group of doctors, there are so many other doctors who felt the draw to come and serve here, and they are coming and serving here. In medical service, you alleviate a person's pain. It can be physical pain, it can be mental problems, it can be any kind of form of distress. And when we relieve the person of this burden of pain, that is apparently one of the best kinds of karmas that we are performing. So our Guru said that this is a very important form of service that you are doing to the community, and you will get a lot of satisfaction, and will also grow spiritually. And we find that is very true. It's not only among us doctors who are treating, but among all the paraclinical staff who are coming here to help. There are people coming to do registration, there are people to come and do take the cards, there are people coming to dispense medication. We all work as a team. There is no smaller person in hierarchy or a higher person in hierarchy. We are all equal. Our whole aim is to provide service to humanity, and therefore we find ourselves blessed in giving this treatment. We are not we expect the patients to be grateful to us for giving the service, whereas we are happy that the patients are coming here and giving us an opportunity to serve them. That is a spirit in which we are serving, and that's a spirit in which we hope we all develop ourselves, because each one is an individual and who is on this earth for a certain purpose, and there's no greater person or lesser person. We are all human created by God, and therefore we are doing this service so that all of us benefit. Some like us who are offering the service get great satisfaction, and the patients who come here are getting relief from the pain.